Walk me through how you see Abu Dhabi playing a role in longevity.
I think Abu Dhabi has a growing role in pretty much every industry. Right now, what we are observing here at the Abu Dhabi Healthcare Week is similar to JP Morgan in San Francisco. And Abu Dhabi attracts really the top talent, the top scientists, the top entrepreneurs, and for a good reason. So it's one of the most inclusive regions in the world.
Tell me this, how does artificial intelligence, in your mind, advance longevity?
So artificial intelligence allows you to identify patterns from cradle to the grave. So you can train AI, modern AI, on massive amounts of data coming from population scale repositories, coming from healthy people and people with disease, and identify patterns that lead to frailty, disease, and disability. And also identify mechanisms that are implicated in aging and disease at the same time. That allows you to develop effective interventions that target disease and aging at the same time, so you can have a commercially tractable therapeutic program within the traditional paradigm of drug development, and at the same time improve significantly healthcare delivery to ultra-personalize and also significantly improve the toolkit that the patient may use to live longer and healthier life.
Yeah. Tell me why, in your mind, people will associate longevity with artificial intelligence.
So artificial intelligence has disrupted every area of our lives. Nowadays, we use ChatGPT and similar tools as our consultant, our doctor, our friend. And those systems become much more intelligent in terms of helping you diagnose disease, identify actionable treatments, diets, exercise, sleep, everything. But most importantly, those systems allow you to identify novel therapeutics. Because currently, my problem in life is that there are massive amount of diagnostic tools you can use to measure aging and disease at the same time. But there are very few tools you can use in order to significantly improve and extend your lifespan. Currently, you can convert time into money, but you cannot convert money into time. And what my company is focused on, and several other companies are also joining the game, is identification of dual-purpose therapeutics that are treating disease and aging. And the best way to do that is by utilizing the modern generative AI technologies that understand the drug discovery and development process from one perspective, and then health delivery process and the drug development process at the same time. So we basically bridge biology, chemistry, and medicine in one, and try to deliver those novel therapeutics that will help us in our war against aging and death.
One of the big, I should say, advantages that Abu Dhabi has, obviously, is their data collection.
So Abu Dhabi is a global mega hub for, again, everything, not only healthcare. And I think that the data collection effort that is happening here is extremely valuable. My company doesn't work with human personal data. We actually try to abstract ourselves from that and use publicly available data focused on biomedical research in order to discover and develop new drugs. However, when it comes to delivering healthcare, then this data is definitely gold mine, because you can ultra-personalize and significantly improve the quality of care for the local population and also possibly global population later on by developing artificial intelligence algorithms that help you identify the right drug at the right time, maybe not even at the time of disease, but maybe before that, in order to extend the healthy, productive portion of human life.
What is the role of the pharmaceutical industry in this? Because they've traditionally been the space for research and development, but it's gone beyond them, hasn't it?
So multiple pharmaceutical companies are now focusing on genomics medicine. I think the front runner in this area is by far Eli Lilly. because they have developed the GLP-1 drugs, GLP-1 GIP drugs. Now they're looking how to personalize that. They've also developed a bunch of drugs that are targeting specific rare diseases and that are curative. So people that couldn't hear, they can hear now. People who couldn't see or had very substantial neurodegenerative diseases now have hope, and they're investing a lot. There are multiple companies that are following in the footsteps and are also investing in this field. Our company is including genomics medicine in the early discovery process, and we are kind of trying to race ahead of pharma in terms of we understand what they want in the future, next 5-10 years, and develop therapeutics that are fully discovered and designed utilizing generative AI and specific genomic biomarkers that can be later utilized for personalization and targeting the targets that the pharmaceutical company is likely to need in the future. We're very happy to have a very substantial base here in Abu Dhabi. We chose this area because it provides great ecosystem and great access internationally. So it's becoming a marketplace of the pharmaceutical industry.
How do you see public-private partnerships impacting the longevity space? I mean, can it happen without them?
I think that the population in developed countries, as it gets more wealthy, it demands higher quality of life. And in many areas, in many of the world, governments that are a little bit more visionary, they like to think about longevity being the fundamental human right. And whenever the country is developed enough and wealthy enough to go after this grand goal, it does. And of course, Abu Dhabi, UAE in general, is one of those places where it happened. So visionary leadership combined with resources, you naturally start developing private-public partnerships. There is also significant private sector formed without the help of the government. You put the right policies in place, you remain neutral, welcoming, diverse, inclusive, tolerant, and suddenly people come, settle, and deliver high-quality healthcare.
Thanks so much for joining us.
Thank you.